Hello, everyone. My name is Ty McCrae, and I am one of the subject matter experts on the long term care component team. And today I will be presenting to you the Prevention Process Measures module, which involves hand hygiene event reporting and gown and glove use event reporting. So, just for those that will be participating with Poll Everywhere, I have two polling questions. So, this is the information. Once again, you can type in NHSN to 22333 to join by phone. And for those that will be doing the web streaming, you can visit the web address pollev.com/NHSN, and you'll be able to join that way. So, in today's presentation, I will introduce the Prevention Process Measures module. Will provide you with the benefits of using and participating in this module. I will explain the protocol and the definitions, and I will provide instructions and illustrations on how to collect your data and input it into the system. But before we get started with learning about Prevention Process Measures module, I wanted to show you a quick little 3-minute video that was prepared by Penn State Hershey Medical Center. Their infection control team generated this video to demonstrate how easy it is to transmit bacteria and viruses among healthcare workers and within the environment. So, we want to see, did our hands really do that?
Warning. Do not confuse any lightheartedness in the following video with a glib attitude toward the problem at hand. The makers of this video are very serious about the prevention of hospital infections. Another busy day. Traffic as usual. Now look at that. He goes right past the hand gel. Doctor!
How's the light today?
I'm a lot of pain, Doc.
Still no better.
No.
All right, let's take a look here.
Not even in gloves? Oh, come on. That doesn't really happen, does it? If you could see what I see. MRSA, VRE, Pseudomonas, etc., etc.
Here, can you take
Your attending isn't wearing gloves, so you're not either, right? Wait, the hand gel.
What? Okay, yes.
Are those gram negatives or gram positives? Oh,
How can I help you?
those microbes spread everywhere.
Yes, I am. Okay, I'll draw that blood right now.
MRSA, VRE, whatever. Good grief. Nurse, you didn't clean your hands either? Oh, man. He just had an operation, and you've put a big IV in his neck. It goes almost all the way to his heart. Please don't! Finally, that's the part I wanted to see. Clean your hands before and after every time you contact the patient or the patient's environment. If your hands are not visibly soiled and the patient doesn't have C. diff, use alcohol-based hand gel to kill those germs. See? Doesn't slow you down. Really, you should also clean your equipment just as often. Your patients thank you.
So, what did you think about that video? I'm sure, how many of you have witnessed that in some of your, yeah, yeah. Although it's very, they use it in a form of comedy, but of course, that is a very important issue. And these are just teaching moments of how we can utilize the tools in place in order to teach others and record our actions. And it's not to be used as punitive, but just to teach them, hey, we need to wash our hands and we use to use the proper PPE in order to treat our patients. So I will begin going into the introduction of the long-term care prevention process measures module. And this module allows facilities to monitor adherence to hand hygiene after contact with the resident or surfaces in the immediate vicinity of the resident, and gown and glove usage in the context of transmission-based precautions. So, prevention process measures module. I know you're wondering what's in it for me. And what is the benefit of using this module? The benefits of using this module is to assist with measuring the adherence to hand hygiene and gown and glove usage within your facility. It reinforces and supports the guidelines of CMS quality assurance. Okay, thank you. And performance improvement efforts to sustain the quality of care and life for nursing home residents, as well as ascertain the impact of facility practices that are focused on specific elements of infection control, which can also aid at reducing the incidence of HAIs and costs. Most importantly, NHSN provides the warehouse for your data of which users can extract to develop and implement appropriate plans and actions for quality deficiencies. So before we move forward, by show of hands, how many facilities already track hand hygiene? Great. And for those facilities that track hand hygiene, oh, sorry about that. I'm going too fast. For those facilities that track hand hygiene, by a show of hands, do more than one person collect this data for you? Okay, great. So next I will go into the hand hygiene protocol. Hand hygiene protocol is it monitors the direct observation of healthcare personnel practices and resident care areas throughout your facility. Long-term staff other than an infection preventionist can be trained to perform the observations and collect the data elements. What we're looking for is the total number performed, which is the total number that you have observed during which it was successfully performed, as well as those observations in which you believe it was warranted. So, for example, if you feel that there were 30 instances in which someone should have utilized hand hygiene, but you were only able to track maybe 25 because that's how many times that they perform it successfully, then that would be the performance over the indicated. So again, you should perform at least 30 unannounced observations of varied healthcare professionals after contact with residents or inanimate objects in residents' vicinities each month. Here are a few hand hygiene opportunities in long-term care facilities. We know that you utilize this process throughout your day-to-day activities. I'm sure that you utilize it prior to touching a resident, prior to clean and aseptic procedures, after body fluid exposure risks, after touching a resident, and after touching resident surroundings. So here's my first polling question to you guys. We're going to do a knowledge check. The first polling question is, how many unannounced observations are suggested to be performed each month? Your options are A, 10, B, 15, and C, 30. So I'll give you a few minutes to enter your answers. Eight percent said letter A, and 30% said the letter C. 92% said the letter C. The correct answer is C. That's because the rationale behind this is we ask that you perform at least 30 unannounced observations of varied healthcare professionals after contact with residents or inanimate objects in residents' vicinities each month. Next, we will discuss the reporting of gown and glove usage. Multi-resistant organisms are increasingly common causes of colonization and infection in long-term care facilities, which can spread from resident to resident by healthcare personnel. Therefore, gown and glove use options will allow facilities to monitor adherence to gown and glove usage when the healthcare worker utilizes the appropriate gown and glove protocol. The appropriate gown and glove protocol is donning of both gown and gloves prior to contact with a resident or inanimate surfaces or objects, and the use of gloves only without a gown would not count as the appropriate use. They have to utilize both. And again, we ask that you perform at least 30 unannounced observations of varied healthcare personnel during their interactions with residents who are placed in transmission-based contact precautions each month. We understand that policies and procedures may vary between facilities, so here are some opportunities in which some may utilize gown and glove usage. That would be administering resident care for wound secretions, cleaning and incontinent residents with diarrhea, if a resident is in contact precaution, responding to an emergency where blood is spurting, and when handling contaminated items. Okay, here's another knowledge check. So get ready. What is considered the appropriate practice of gown and glove use by healthcare personnel? A, use of gown during interactions with residents who are placed on contact precautions. B, only when gloves are used. And C, donning of both gown and gloves prior to contact with the resident or surfaces or objects in vicinity of resident placed in transmission-based contact precautions. So I'll give you a few moments to make your selections. Well, it looks like everyone selected the letter C, which is correct. Donning of both gown and gloves prior to contact with the resident or surfaces or objects in vicinity of resident placed in transition-based precautions. That is correct. Next, I want to spend a little bit more time in your data collection process and tools for NHSN. I know we always say you may not have time to collect this data, but all we're seeking is more of your aggregate data. So if you already have tools in place, We're just looking for the total count for the month, and I'll talk about that further. So, the data collection process, we ask that your observations be discreet, and that is to prevent staff disruption while administering care and to prevent data collection from influencing staff performance. Also, we ask that you try to ensure that your observations are as representative as possible of normal practices in your facility. That means to observe different staff members on different days and shifts. Consider observing during particularly busy times, for example, shift change, or when staff may be less attentive to proper practices. We also ask that you focus on an area of the unit where staff interaction with residents are clearly visible. This may include observation of several staff members, or hand hygiene should be performed prior to and following direct contact with residents. This is our main long-term care page where you can find some of the resources and tools for the prevention process measures module. If you click on the long-term care facilities on the menu on the left navigation panel, or if you click on the model title, you can access your resources that way. And here is an example of once you click on that area, what you will encounter. And you can click to obtain your resources and forms there as well. This is an example of our NHSN form for the Prevention Process Measures Monthly Monitoring. It resembles the same face as if you would go into NHSN and enter the data. It's just specific for prevention process measures reporting. And again, as mentioned in earlier presentations, you can customize this form. And most importantly, we're only asking for total counts. That is your numerator, which is performed or used in which they did it successfully, and your denominator, in which those could have been done as a total. So for instance, if you think that there could have been 30 instances utilized, but they only did 25. So your numerator would show 25 and your denominator would be over 30. And again, it is available on our website. Here are a few observation tools. I'm not sure, for those that are already collecting their hand hygiene, you may already have a tool in place. The prevention process measure form is not utilized for you to collect your numbers. It is only utilized for you to put in your aggregate numbers. So we would just need a total for that month. So now we're going to move into the reporting requirements. So facilities must indicate if they're going to do hand hygiene and or gown and glove use surveillance in your monthly reporting plans for long-term care. The prior presenter, Angela, has already did a deep dive in your monthly reporting plan, so you should have enough information about your monthly reporting plans. But if you do have a monthly reporting plan already been saved, you can edit your MRP, which is monthly reporting plan, and add hand hygiene and or gown and glove usage. Again, we ask that you perform at least 30 unannounced observations of healthcare personnel interactions. And we strongly recommend surveillance should be reported for at least 6 consecutive months to provide meaningful measures. They should be facility-wide. It should include all types of healthcare personnel. Again, that is for both hand hygiene and gown and glove usage. They should all be facility-wide. So if you want to get started with monthly reporting and you wanted to add hand hygiene or the prevention process measure module, and you want to include hand hygiene and gown and glove use, you click on your ad on the navigation panel. You select your month and your year, and you indicate which one you want to utilize. If you want to do hand hygiene or gown and glove use, or you can click for both. And make sure you hit save to save your monthly reporting plan. And as I mentioned, if you already have a monthly reporting plan in place, it can be edited as long as there are no events that you have entered for that month. So, but you can add hand hygiene and gown and glove use to your already existing monthly reporting plans. And what you would need to do is click on Find and Edit. And that is your option to edit your current monthly reporting plan. This is an example of how a completed monthly reporting plan looks. If you notice on the bottom, hand hygiene and gown and glove use was both selected. In addition, if this was someone's monthly reporting plan, you would see that they already have UTI and also lab ID selected, but they have chosen to include hand hygiene and gown and glove usage. Now it's time to report your summary data. From the navigation bar on your summary data, you would click Add. You would enter your month and your year, and you would enter what was performed and what was indicated. And for gown and glove use, you would select what was used and what was indicated. And again, performed and used are those instances in which it was actually done successfully. Indicated are those observations that you perceive could have been exercised. And again, make sure that you click Save. Important note, we only want aggregate numbers. So this form and your summary data are not used to collect or to track. It's only used to enter your aggregate data into the application. This is how a completed monthly summary data would look once you have entered all of your numbers. So in this instance, hand hygiene performed was 50, but what could have been observed and utilized was 60, as well as gown and glove use, 30 was used and 50 was indicated. So you may be wondering, well, how is this meaningful for me? This particular module is meaningful because it will assist you with calculating rates of adherence for hand hygiene and gown and glove use opportunities in your facility. It can also be utilized to provide feedback to your staff, and it also can be utilized to assess any impact of efforts. So I'm sure most of you already have risk assessments in place. So this information can be utilized to assist you with your risk assessments that you conduct each year and have to prepare for. As well as this data can also be used if you need to meet with your staff or your administrators. You can provide them with this information. And this is which is exciting. We're going to be coming out with a new dashboard, which is facility level. It is interactive. And this is just an example. And some of you have already attended the dashboard session on yesterday. And we will get a little brief presentation on this shortly. But this is how your information can be viewed for your facility. So let's review. You can perform monitoring of hand hygiene and gown and glove usage, or you can do both. To get the most from your data, we ask that you report at least 6 months. We ask that you include all types of healthcare personnel throughout your facility, and we ask for a minimum of 30 observations to be per month for each event. Also, long-term staff can be trained to perform the observations, to collect required data elements, and to analyze the data. So it's always good to have a second pair of eyes or hands, 2, 3, or more, to assist you with this collection process. Here are a few of our resources, our homepage, if you need information more about our component in general. And also, if you just want more information about the Prevention Process Measures module, you can also email us at nhsn@cdc.gov if you want more information or if you have specific questions. And that concludes my presentation for today. Are there any questions? Okay, well, I hope that you enjoyed that. I hope it was very informative. And again, if you have any questions, you can email us at nhsn@cdc.gov. And of course, I'll be around the rest of the week. If you have any questions that come across, you can stop me. Thank you.